Thank you for joining us. Today I have Dr. Patrick Alore, and we're going to be talking about ovarian cancer. Thank you for joining us.
You're welcome.
So ovarian cancer, called the silent killer, why?
Well, unfortunately, ovarian cancer doesn't present with symptoms very early and oftentimes doesn't present with symptoms at all until disease is quite far spread. So it was given the name the silent killer because oftentimes people would be given a terminal diagnosis before they even realized they had cancer or symptoms.
Wow. Is ovarian, obviously it's for women, do they have, like you said, not very many signs, but are there certain things that we should pay attention to?
There are definitely some symptoms that should be paid attention to. One is abdominal bloating or a feeling of gassiness, but not related to food.
Mm-hmm.
So if a woman notices there's a long-term swelling, this could be an early sign. Back pain, pelvic pain, nausea, weight loss, fatigue.
Okay.
But a lot of those symptoms, could be used to describe a lot of different illnesses.
Right.
So again, they're not very helpful, not very specific.
And when you say ovarian cancer, is it the fallopian tube area, the ovaries themselves within there, or where?
So ovarian cancer specifically refers to a cancer which begins in the ovary from ovary cells,
Okay.
and can either remain within the ovary and stay within a normal-sized ovary, or grow and fill the pelvis, or even spread to other organs of the abdomen, chest, the bones, or lymph nodes.
Wow, okay. What are some of the risk factors?
The risk factors for the development of ovarian cancer include genetic factors such as the BRCA1 and BRCA2 gene mutation, which can also be seen in breast cancer,
Mm-hmm.
Lynch syndrome, other family inherited disorders, long-term estrogen replacement, older age, and the length of a patient's menses. So in other words, from the day that they started menstruation in puberty until the day that they ended. And the longer that duration is, the higher risk they are for the development of ovarian cancer, because the longer they're exposed to estrogen. The more estrogen a patient has throughout their lifetime, the higher their risk for the development of ovarian cancer.
Okay. Now when you say family, immediate family, like mother, father?
Mother, father, aunts, uncles, I'm not quite as confident about, but brothers and sisters, that would also fall in there.
Okay,
Yeah.
all right. And then, is it preventable?
It is not preventable, but you can lower your risk by taking birth control, because that decreases your long-term estrogen exposure over your life.
Only birth control. Is there anything else?
Well, I'm sure there's other types of hormonal augmentation that can be done,
Okay.
but also if you have a BRCA1 or BRCA2 gene mutation or Lynch syndrome or other inherited syndromes, and you know that you're going to be at a high risk for ovarian cancer, or if everyone in your family had ovarian cancer, then you could elect to have your ovaries removed, much like patients with a high risk of breast cancer could elect to have a mastectomy.
I see. Now you refer to the brackets. How do they get tested for that?
The BRCA genes, it's a blood test,
Okay.
and it's a genetic blood test, basically.
Okay, so it's something they could elect to do.
Correct, and it's usually done in conjunction with breast screening. So if a patient has a breast cancer, or they have a family history of breast cancer, their doctor might choose to test them for the BRCA gene mutations, and that's usually when they find out that they have those mutations and that they might need to consider having their ovaries removed as well.
I see. Okay. And then how do you detect it?
The best way to detect ovarian cancer is to start with a pelvic physical examination from your doctor. That's usually, physical exam is always the best way to start looking for anything. But if you're suspicious, either by the physical examination or by the history, signs, and symptoms, you really should move to an ultrasound, even if the pelvic physical exam is negative. So the first imaging test would be an ultrasound. And if an abnormality is seen in the ovaries on the ultrasound, then you would get an MRI, which would help characterize the ovaries further, or the abnormality in the ovaries, and help say that you have a suspicious finding or a non-suspicious finding. If it was suspicious, then you might either go right to surgery. Sometimes these are not biopsied, or your doctor may elect to biopsy the abnormality.
So when women go and they have their yearly exams, their PAPs and things like that, are they testing for something like this?
Well, actually, a pap smear does not test for ovarian cancer. It only tests for cervical cancer.
Okay.
So a pap smear is not helpful. Now, the pelvic physical examination is helpful if there was a large ovarian mass.
Right.
The doctor may feel some fullness in the pelvis or firmness in the pelvis and be alerted to a problem. But at that point, it's probably significantly far along to make those kind of symptoms or those kind of signs on physical examination, but still treatable. But I guess that's why I was saying, even if the physical examination is negative, if the patient has a BRCA gene mutation and a family history and pelvic swelling, in the setting of a normal physical exam, they should still go for the imaging, for the ultrasound to start.
And with some of the technologies that we have today, is it easier to treat ovarian cancer if they are further along?
It is. I believe it is easier to treat it. First of all, we can diagnose it earlier. So, and now we have surgery, chemotherapy, radiation, all can treat it. The radiation can be delivered different ways, either just the standard beam radiation. It can be treated via a liquid that's infused through the stomach, or into the abdomen, I should say, as well as chemotherapy infused, if the ovarian cancer has spread further. And there are always new chemotherapy regimens coming out that help treat ovarian cancer.
Okay.
Is it always curable? No, but it's always getting better.
Okay. And what are some of the things that RadNet is doing to help further along what they do for people with ovarian cancer?
Well, we really have improved our MRI imaging protocols to specifically evaluate ovarian cancer. Also, we have a large PET-CT program, our oncology program, where we have specialized readers reading these exams, the MRIs and the PET-CTs. I think those are the major.
All right. Well, thank you very much for the information.
You're welcome.
And remember, if you'd like more information about what we just discussed, please visit radnet.com.